Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello. What a wonderful time will we have today. Because it's not going to be a one-way show right now. It's going to be something that you give to me and I give it back to you in your own terms. All right. And that's why today's edition is going to be completely different. We've been able to receive a lot of text messages, a lot of chats, all regarding to health of the people, which unfortunately not well known before now. But thank God for this very mission that by the year 2025, come on, keep this as a record, that knowledge of health will be like the sand of the seashore. Everyone will get to know what to do in certain health situation, in emergencies time, and all that is going to be available to everybody. Watch out, that is the vision of Dr. Save a Life Foundation come 2025. In addition to moving Nigerian life expectancy to 70 years, how possible, watch out, any moment from now we will roll out our app that will be your personal companion and your personal doctor. Thank you very much. This is a very special day. I have a number of text messages and chat people sent for, and we want to look at some of them. If you have yours, a question that has been a concern to you regarding health, your health, the health of your loved one, you can send it as a text message while we look at each and every one of them. And let me first of all take out, I have some very striking ones. While I use the word striking because there are certain misconceptions I will also like us to address here. And let's look at this very first one. It said, Dr. Save a Life, God bless you for the good work you are doing. Thank you very much. I just got a call that my father has been urinating for more than 10 times, especially at night. 3 days ago, he urinated blood. They went to lab and he said infection. They have treated, but he is not getting better. Please, what do we do? Yeah, this is very interesting. As a matter of fact, I chose this based on certain sensitive information that she delivered to us here. She is pointing out that a call came and stating that the father was urinating very often, up to 10 times, he said, especially at night. And another thing is that also that he urinated blood a couple of days ago. And they went for lab, and the lab showed his infection. They treated the infection, and now coming to ask us, what do we do? Very, very interesting, because that is the mission of this very project. Being able to decode medical information in a language of a common man to be able to help out. Now, let's be able to look at that. That particular man who has a problem that has to do with frequent urination. That is the first thing. And we will be able to say, frequent urination, we were not told whether he is diabetic or not diabetic. But let's look at it in the line of what could cause him being in position to be urinating frequently, especially at night. Yeah, classically, one of the classical symptoms of diabetes is frequent urination. So if somebody is urinating frequently, the first thing first is to be in position to do a fasting blood sugar to confirm that this other person is not diabetic. Okay? That is the first thing to do. Second aspect also, you look at the age of the man. Being a father, obviously must have been up to more than 50 years. And there is something that is very peculiar over the age of 50, and that is issue of prostate enlargement. And we use this also to demonstrate what really happened in prostate enlargement, okay? And then prostate enlargement can cause a man who is not diabetic to be urinating very frequent. As a matter of fact, some of them may even have a bucket because they may not have opportunity to move to the toilet, so they keep bucket right there near their bed so that they can easily come down and urinate. I will explain that based on this very report. We go further. As a young man, what is called prostatitis can cause issue of frequent urination. Urinary tract infection can cause frequent urination. There's also another type of diabetes that is called diabetic insipidus. It's different from diabetic mellitus, the sugar one you know. There is one that is called diabetic insipidus. Why this one was as a result of insulin deficiency or insufficiency. This one is as a result of diuretic hormone, a hormone being produced from the kidney. When that hormone is not there to reabsorb water into the body, the person may be urinating very, very frequent. Okay, having established that these are all differential diagnoses of what could be caused frequent urination, because we need to narrow it down to the men at this very point in time. Now we look further. He said that after some days, 2 months urinating frequently, and unfortunately, 2 days ago, according to her, the man started urinating blood. Goodness me. And when someone urinates blood, be it a man or a woman, it's a thing of ultimate concern, particularly when this person is above 50. If it's a woman that has gone into menopause, you can now be adding issue or cancer of the endometrial cancer and also cervical cancer and all that. But we are talking about a man now urinating blood. Now, we got also that he is urinating blood, and we are here again to ask a question. What could be responsible for someone who's supposed to be passing out urine like water, and now the urine is mixing to be reddish and some can release frank blood? And now we tell you, there are things that could cause somebody urinating blood. For a man, we have a concern, particularly based on his history of having frequent urination. You may look at the possibility of prostate cancer first, which I will tell you when we go into this demonstration. And prostate cancer as a primary for the men. Second one also is there could be a problem of what is called bladder tumor. It could be bladder cancer, it could be benign, but bladder tumor. When there is a tumor that have eroded into the wall of the bladder, that could cause bleeding. Okay, so that actually has to be ruled out in this very case we're analyzing. And we go further. If a man who is having a prostate enlargement, which causes the frequency, okay, according to this very case right now, because the urine is not flowing out as it's supposed to flow, the pipe is narrowed, which means more urine will be right there in the inside. You get that? And because of more urine will come with all the debris and all the toxins and whatever is supposed to pour out, and they're staying back inside the bladder, there is a tendency for issue of stone formation. Forming of stone, what you call bladder stone. It could even be kidney stone. It could be bladder stone, because of the stagnancy of those things that are supposed to freely go out. Do you understand that? So when this person develops bladder stone or kidney stone, now sometimes in the course of those small stones trying to pass through the pipe of the penis, they call it the urethra, to be able to come out, it may scratch the wall, and that very wall will start bleeding. So you may see also urine mixed with blood. So at that very point in time, we are not here to establish your dad has a prostate cancer, because I know you're a fan of this very program since you got it there. We are not here to establish that your dad has prostate cancer. It is only one of the differential diagnosis, even though it is of a high index of suspicion. I don't hope you are following here, but I will explain a little further here. Then we look at the one problem we have in Nigeria, and that very problem is the problem of diagnosis following a lab test. He said that my father had a frequent urination, and after frequent urination for 2 months, a couple of days ago, he He started urinating blood, and they went for lab. They went for lab. I'm not saying you shouldn't go to lab, but what are they going there to do? Who is leading them? Who is guiding them? That is the room for professional assistance. That is the room where that thing you are suffering, you need to be advised professionally by your doctor, who will send you based on what you are seeing from your examination, what you are seeing from the clinical report that is given. Then he will say, go and do this and do this. And they went to lab, as most of us do. Now, whenever you have a problem, you go to lab. What are you finding? What are you seeking for? And what do you intend to find? In a number of occasions, just like she said, they have gone to lab and they said infection. They said it's infection. The question now remains, does infection, what kind of infection should be responsible for frequent urination? What kind of infection should become responsible for blood in the urine? And I will tell you, because I will not be that it's completely, no, there's no room for infection. Yeah, frequent urination can be caused by urinary tract infection, but as per this man's case, it is one of the secondary considerations. It's a secondary consideration, considering the fact that this has lingered for 2 months. According to her text message, it has lingered for 2 good months. All right. So it is not issue of the person has infection. There's also what is called schistosomiasis. It's a kind of infection happening in the children. It's a kind of riverine water infection that can cause something like a blood in the urine and disappear. That's for children, actually. It's not for this very case. So when you have a situation like this, it's not a function of going to lab. You need to go to hospital. So the summary of it is that you need to take your father to the hospital first. Tell them to take your dad to the hospital. Let the doctor properly examine him and prescribe the right investigations, and based on the collation of the investigation, then a proper diagnosis can be made and the treatment be given in line for your daddy to be well. Stay tuned. When I come back, we will now look at the issue that has to do with how did this man start urinating frequently when he's not diabetic, perhaps. Okay, how did it happen? I would like us to stay tuned, call all your friends. We're going to look at it again and see what our men are passing through and how such could be prevented. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye, the president of Doctors Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. And we are in a vision, strong. As I tell you, you watch out what is going to happen a couple of months from now. You will have a medical app right there as your companion, a medical doctor that will give you information that has to do with health, interestingly, in your own language. That's why we have the confidence that by the year 2025, Nigerian life expectancy will move. Sure, from 55 years currently, watching COVID or no COVID, whatever the devastation, we will move up 2025 because we get to know what to do even where there is no doctor. Watch out for it. Doctor Save a Life app. Watch out for it. Now, today's edition is a quite interactive, and interactive in the sense that you have the opportunity now. All the while we have been trying to teach you this and teach you this. I know you're a good listener and a good student of this particular program. I want you to begin right now to send back. This very number here, you have a health challenge or your loved one seeking for what to do, don't know how to do it, go about it. Stop first. Don't go and give it to devil, because those that follow that very path have not returned till date. Majority of them are in the grave, saying that one attack, one demon. We will not undermine that. But we are saying, let us start from the known before we start going to the unknown. That's your health problem. There could be a way out. You send it as a text message. We will read it out here for everybody to benefit. And part of the ones we received is a story of a lady who sent us a text on behalf of the father. That's saying that the father has been urinating frequently for the past 2 months. Only a couple of days ago, he started urinating blood. And based on that urinating blood, they ran tests. And the test said that it's infection, and they treated the infection, but the man was not getting better. And he is asking us, what do we do? And that's what we have been able just to discuss in our first segment. In case you miss out in that very vital information we shared there, you could be in position to watch this very program on our YouTube channel. All the handles are here and other social media handles, okay? You could be in position to watch it. Right now, let us be in position to look at this very prostate. And look at the most possible. We are not saying because we've not done the full diagnosis, it's not just about the infection. We've not gotten the full detail. But most probably, what he may be having has to do with prostate enlargement, number one, and also a suspected prostate cancer. Otherwise, you rule out the issue that has to do with bladder tumor or bladder cancer, or you rule out issue of a stone coming out from there that may scratch the wall, and you also see see blood in the urine. By and by, let's look at this so that you'll be able to understand it. Look at this classically, okay? This is just like a model, however, like a human being, a man this time around, that is sliced into two. So this is a half dissection to enable you see whatever you want to see right inside, okay? So if you look at this critically, you can see this very wall here. This is urinary bladder, all right? The urine comes through here into here from the kidney, it comes down here, all right? But I want you to watch out something here. There is a relationship between this very bladder and look at pipe of the urine coming out. It should come out and follow this way and come out. I do hope you appreciate that. Having noted that, I want you to look at something very, very significant here. Look at it. There's a relationship between this very bladder here, and if you see the bladder, when the urine is full, it gets through this very axis and go this way and is out. All right? That's how the man urinates. When he's pressed, the bladder full, it goes out. Okay? But check out something here. There's a relationship between this bladder and something like a half of the apple right now, cut into two. All right? This very half apple here, located at the neck of the bladder, is called the prostate. Don't forget, woman is not in your body. It's only present in men, okay? But you watch it because we all have fathers, we have relatives, we have friends, men complaining on what this woman is talking about, and it will go a long way to help. Now, having seen this in this very front, sometimes under this prostate also you have the rectum where the stool comes. That's why some of them can have constipation when they have prostate enlargement that is quite massive. All right. Now, having been able to see this, this is normal. There's a relationship here. It doesn't disturb this very pipe. It goes off. But sometimes, after the age of 50, all right, there could be a development that the cause of it is not absolutely known. All right? And there could be an enlargement of this very prostate. And when this very prostate starts enlarging initially and enlarge towards this bladder, it will now touch the bladder. The bladder has a smooth muscle that gets a little bit irritated. So when the very prostate tap on it, the man will feel as if the bladder is full and he will want to go and wee. All of a sudden, he will go out and urinate. He will come back again. He touch it again, he will go back. So it will make this man to be having frequent urination. But one unique thing about that urine is that despite the fact that he is feeling pressed to go, but when he gets there, he's not urinating as much volume as expected based on his own psychology of being pressed. You get what I mean? So because of the irritation of this on the bladder, take note of that. Sometimes also they may have a problem of urgency. Urgency in the sense that it could be in position whereby if you want to go and wee, if it doesn't go out immediately, it will feel as if it doesn't go, it will pour on his body. That's why some of them may even get a bucket by their side while they're sleeping. All right? So that's exactly what happened. In addition to frequency, all right, then urinating more frequent, they could also have a problem on what is called urgency. Urgency is the type that even before once they get pressed, they feel as if you don't go faster, you will be in position to urinate on this. That's exactly what is called urgency. It's also associated with it. That's why a number of them will have buckets right there on their bed that if there's any problem, they can easily come and wee. So that's what could happen. Further things that could happen, which she didn't tell us in that very text message, is that if this also continue to enlarge, interesting thing as you see here, if you look at this very pipe, there's a pipe where urine is supposed to pass. If this now try to expand and come closer here, it may start closing this very hole. And once this very pipe is being closed, the man will now start having what is called retention. And in the case of retention, is that he will get to the restroom and he will stay there and wee. He may not be coming out very fine, the pressure won't be there. But because the urine is not coming as expected, some will remain. And he knew that some are still there, but there's nothing he can do. After waiting for a while, it's not coming, he will carry the half tank and go. After which he come back again. So that is one of the things, because of the narrowing of this pipe, by reason of the expansion of this enlargement of this prostate. In some occasion, the thing can close up. Final. It will just close. And when it close, that's why you see a number of men, they will rush them to hospital, they will now put a pipe, what is called catheter. You must have seen a number of them, carry. If this also enlarge behind, it may compress this very rectum. And when you compress the rectum, the person may start having constipation. All right? In addition to that, nevertheless, if the very prostate become cancerous, there's a tendency of eating through into this very wall, and it may make the urine to become bloody. So that is a very important thing to know. So I would like to encourage our sister, call your family right now, let them be in position to take your daddy to the hospital, and let a doctor, preferably urologist, be in position to properly evaluate him. And upon evaluation, they will be able just to profile solution to this kind of problem. And today that we are actually dealing with this very case, which we are narrowing down to prostate, I want you to stay tuned. When I come back, we are going to look at, is there any solution, as she asks, what is the solution to this kind of a problem? Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
I cannot believe it that this is the same me that came here with not having the hope of being on my feet again, that I can walk again like a normal human being. I want to thank Doctors Save a Life Foundation for this wonderful work. To God and to God only be the glory.
You and Your Health with Dr. Richard Okoye.
Welcome back. I do hope today has been a very, very interesting day. We want to open this very channel from now to become more interactive, saying to you, come over, we got your question. Don't go and make rash decision. Don't go and be drinking what you cannot explain. Why not ask that very question and receive professional answer? As you send it here, don't worry about the name. It's not necessary. You can send it as anonymous. And when you send it here, we could be in position to read it out, and everyone. Don't forget, the Bible says that the problem you are passing through is common to all men. Don't assume that this is my peculiar problem. No, a lot of people are suffering the same. So we could be in position to share it, just like a lady told us about the father having frequent urination, urinating blood, and going to go and do tests, and they say it's infection. Crazy. All right. So today we've been able to debunk that. But let's have it narrowed down to this issue of prostate, because she's asking us, what do I do? And what you have to do, as earlier said, is to get to the hospital, let the doctor be in position to properly diagnose your daddy. And if he boils down to the issue of prostate, which is more common in that age group, we could be in position to consider there are 3 options you can do. There are drugs. If it is non-cancerous type, the one you call benign prostatic hypertrophy, okay? Benign prostatic hypertrophy, BPH, that particular one, there are drugs that are available. Most of them are alpha blockers that could be able just to relax the muscles and enable him to be in position to urinate better. But in a situation, the symptom persisted, or you're not able to urinate, or is carrying catheter, there's no room for you carrying catheter anymore, because today you could be able to do a prostate surgery, which you could be in position to open up and harvest them. But also in the modern time, you do what is called laser prostatectomy, or even transurethral resection of the prostate. This particular one does not require tearing the body open to get to here. Through the pipe, that machine can go in and go and reset this very prostate to enable the person to start urinating. Maximum of a day, the person can start urinating like a baby. If you look at this is what is called laser prostatectomy. You find out how this thing goes in, you know, and be able just to reset the prostate and be able to control the bleeding. And this very person could be able again to urinate freely without pain and without order within a couple of 1 day procedure. It's about an hour procedure, not too much. And furthermore, in a situation that is a cancer, the game will be different. And the first thing first is to be able to know his PSA level, what is called prostate specific antigen. When the PSA is known, if it is high beyond the normal level, it becomes suspicious of cancer, not that it is cancer. At that point, you may go a little further. When the doctor meets that case, he can do what is called anal examination. If you put up a glove finger and through the anus, you find out you can feed this very prostate through this very place, and then you could be in position to check the texture. Normal prostate should be like normal smooth liver, all right? If you rub it in liver, but once it becomes cancerous, it may become a little bit hard and undulating this way, so it's suspicious. So, having been able to do that, you can now be in position to do what is called prostate biopsy. The prostate biopsy gives the information that this is a prostate cancer. Treatment can be varied in a number of occasions. If it is still an early stage of prostate and is captured, it can be cured, because there are a lot of survivors of prostate cancer. Nelson Mandela had prostate cancer at 85, died 95 of bronchopneumonia. Also, Emperor Akihito of Japan also suffered prostate cancer and lived prostate free. And also, Archbishop Desmond Tutu, South Africa, Colin Powell of United States, all suffered, and they are all living. They live cancer free. So, on that very accord, do not be afraid. Prostate cancer is a slow-growing tumor. That's why I always encourage early diagnosis. I want you to send more of your questions here. Then we will come out and again be able to evaluate it and give our people the right direction and share whatever knowledge you got right now. Go out there and save someone through the power of knowledge as I see you again.